Pause is brought to you by Defend Drill Cough, Expectorant, Defend Drill Breathe Easy and Feel Better. My name is Elton Brobe. Let me cross you to Parliament now, where the minority side is holding a news conference on the 1 cedi levy imposed on petroleum products. Kojo Ponkroma is a ranking member on the Economic Committee.
They will do the next opposite, the exact opposite. But they made these firm promises with a view to scam the unsuspecting voter and trick the voter into giving them power. Today, we have come full cycle on the energy sector levy. This hypocrisy, this unethical behavior will not be allowed to pass. In an attempt to normalize the hypocrisy and betrayal of trust, the NDC has recruited its mouthpieces to attempt to deceive Ghanaians that it is only a 1 Ghana cedi sacrifice and all must go along. And so-called neutral who does the NDC's bidding in this scam should be ashamed of himself or herself. You are part of the program. The NDC hypocrisy has now been exposed by the fact that in their bid to justify what they knew they will do, they have now come up with confusing explanations as to why this levy is needed and inevitable. His Excellency President Mahama on May 13, 2025, at African CEO Summit in Abidjan, this is what he said, and I quote, "We are using the proceeds from the energy sector levy to pay down the arrears," unquote. Honorable John Jinapo, the energy minister, also on June 4th, 2025, this is what also he said on Joy FM, City FM, and Joy News. I quote, "This levy is not intended to pay off legacy debt. The liquid fuels we currently purchase are not part of the tariff structure. We require over $1 billion this year, $1 billion this year alone to procure liquid fuels." So, members of the press, which is which? Is this levy to pay debt or to buy fuel? The NDC has forgotten that they had announced earlier that they will finish the payment of the energy sector debt by December 2026. His Excellency President Mahama at the summit in Abidjan also said, announcing at the conference that he will clear the energy sector debt by December 2026. At the time this was announced, they had not told the people of Ghana that they were going to introduce a levy to attempt to do this, assuming this levy is for debt payment. So is it that they had planned this levy all along and lied that they wouldn't impose a levy? Or didn't have a clue but were just promising? Further, assuming without admitting that this is for debt payment, how can you pay $3.1 billion, that is amounting to 80 billion cedis, total debt, with 9 billion cedis, which will accrue by December 2026 from this levy? Is that even feasible? And if indeed this is for debt payment, why are they, after telling us that the debt will be paid by 2026 December, now turning around to say even the levy is not enough? Ladies and gentlemen, the hypocrisy and the ill intent from the beginning has now been exposed by their confusing reasoning. Members of the press, it is very important to know the very clandestine manner in which the NDC sneaked this bill into Parliament without prior notice and rushed it through in the dead of the night, simple to avoid scrutiny. This bill was never advertised on the order paper for the day. In fact, it was not even discussed at the business committee meeting prior. It was not included in the business statement for the week. Instead, it was sneaked through by a one-page order paper addendum, getting to the end of sitting on the said day under a certificate of urgency. And the majority side whipped it through, refusing to pull the brakes for any form of consultation with civil society, driver unions, or everyday Ghanaians. Why will a party that campaign on the grounds that they will champion the interests of Ghanaians now be sneaking tax bills into Parliament in the middle of the night and rushing it through before Ghanaians wake up? Why will a party that claim they had the Ghanaian interests at heart refuse to allow debate and public representation on tax bills, which they didn't advertise at budget time? Members of the press, the clandestine approach also exposes the ills of the government in this matter and will not be allowed to pass. At this juncture, I will allow my colleague, the ranking member for Economy and Development, to continue. Thank you.
So thank you, Honorable Ranking Member for the Committee on Energy. And he has set the tone by highlighting the very clandestine manner in which the government brought this bill to Parliament. Wasn't discussed at a business committee meeting, wasn't listed on the order paper, it wasn't even mentioned during the budget hearing. And then getting to the end of hearing for the day, an order paper addendum was brought in and it was quickly hurried through. Even efforts from the minority leader to request that we suspend and allow more consultation were refused. And that's why you realize that before its passage, our side had to wash our hands of what was being done to the people of Ghana and leave the chamber. Now, you are beginning to notice that, for example, the Chamber of Oil Distributors are openly calling it out that nobody was consulted. And this was smuggled in and infringed on the people of Ghana. And they've been pushing back, and now government says it will wait for a few days before it still goes ahead to implement it. You are also noticing that the driver unions are shocked and are calling government out for what it has done and are threatening even demonstrations in some instances. Now, we want to take a moment to highlight some things about the levy that, because the people of Ghana didn't get an opportunity to have a full discussion on it, have come up and we think we need to draw your attention to. First is the rate that is being charged. Ghanaians will bear witness that this levy is being charged at a rate of 8% per transaction. 8% per transaction. And this makes it one of the highest tax rates introduced in Ghana in a single instance. If you study the history of VAT and many of our other revenue handles, you notice that at the first instance of introduction, sometimes it's 1%, 1.5%, or 2%, and then maybe as the years go by, you may find some add-ons and then a consolidation. For this particular levy, at the first instance, the government is charging the people of Ghana 8%. And this is one of the highest rates at first instance in terms of taxation that is being introduced in the Republic. Again, even if this levy wasn't hypocritical, as has been mentioned by my brother, and had an honest justification, why would the government impose a levy with an 8% transaction rate on the people of Ghana? It's just simple wickedness. And to think that this 8% is on every gallon of fuel, actually cascading down to every liter of fuel, to pay for the inefficiencies in the energy sector, is simply a stab in the back of many people who believe the government at their word that they will not impose levies to pay for the inefficiencies in the energy sector. Now, for every 1 gallon of petrol product that you buy or diesel that you buy, this government is, because of this tax, going to take an additional 4 cedis and 50 pesos from you. That is 8%. We recall the NDC's claim that the then MPP government had done no work for Ghanaians when they are transferring their money, and therefore had no business in charging 1% levy on Momo transactions. So we ask you, what is the work that the NDC has done when you are buying your fuel, for which reason they are now charging 8% tax on it? Specifically, let's take a moment to compare this Doomsaw levy, the D-Levy, to the E-Levy that was recently repealed. It will be recalled that when the MPP introduced the E-Levy, our then colleagues in opposition bastardized it and told Ghanaians that it represented thievery. In fact, they used the expression pickpocketing. Unfortunately, a good number of Ghanaians bought into their propaganda. So let's compare the E-Levy to the Doomsaw levy, which has now been introduced by the NDC. First, the E-Levy was advertised in the budget. It was followed up with town hall meetings, and it onboarded extensive public consultations before the bill was finally passed in Parliament. This Doomsaw levy was smuggled through to avoid any form of public engagement, consultation, or scrutiny. It was neither advertised in the budget nor in the main order paper for the day. And that's why we say that this amounts to midnight robbery. The E-Levy had an effective rate of 1% per transaction, yet it was described as pickpocketing. This Doomsaw levy has the effective rate of 8% per transaction. And that's why we say that it is midnight robbery. The E-Levy avoided transactions that were not in excess of 100 Ghana cedis, you will recall. And the argument that was canvassed at the time was that we had to create some room for the very poor to be excluded from it. Yet the E-Levy was bastardized. The poor were exempted. This Doomsaw levy has no minimum threshold. The poor are actually the most affected because, unlike the rich, for the poor, every single cedi counts a lot more. And that's why we say it's midnight robbery. The E-Levy, number 4, was payable only by people who opted to do money transfers. This Doomsaw levy is payable by all Ghanaians, unless you decide to work every day. Because even if you're a farmer and you are buying fuel for your tractors to work on your farm, you will pay this Doomsaw levy that this government has just imposed. It's payable by everybody. Number 5, while the E-Levy had a limited cascading effect, this Doomsaw levy has a total 100% cascading effect because it affects transportation. And consequently, any item that is transported, food, clothes, whatever, once you are transporting it, there's a cascading effect that eventually, when we go full circle, will be paid by the everyday Ghanaian. Number 6, the E-Levy was designed to yield approximately 2 billion Ghana cedis from persons who elected to do transfers or transactions. Now, colleagues, you are here in Parliament. You will recall the day that the E-Levy was repealed. Our good friend, the majority leader, was on his feet, shouting his voice hoarse that the government has put 2 billion cedis back into the pockets of Ghanaians. I'm sure you recall. This Doomsaw levy is taking from everybody over 5.7 billion cedis for this fiscal year. So if repealing the E-Levy put 2 billion back into the pockets of Ghanaians, what does introducing the Doomsaw levy that takes away 5.7 billion do? In his own words, this government is taking 5.7 billion Ghana cedis from the pocket of Ghanaians. And we think it is very dishonest because if you claim that you are giving Ghanaians 2 billion back, which was so untoward, it was evil by the previous administration, how do you give back 2 billion and take 5.7 billion from the people? It's only the NDC government that does that, justifies it, and expects everybody to say that that is some smart economic approach. We, however, have some alternative suggestions to make to the government, and I'd like to highlight a few of them. The minority believes strongly that if this government is minded to pay off the energy sector debt, because you recall that part of their justification is that they want to pay off the energy sector debt. In fact, the president said he'll pay it off by December 2026. And we have just done the maths for you, that if you look at what is going to accrue in the 2 years, it cannot pay off the energy sector debt. But let us assume that they are being honest with that they want to pay off the energy sector debt. We think that what the government should do is to conclude the renegotiations of the public of the power purchase agreements which were started by the previous administration, and to pass on two things: the fuel and capacity charges into the PPAs. Government should include these in the tariff calculations to eliminate the need for off-book debts that are caused by the take-or-pay clauses in the energy sector contracts that were signed between 2013 and 2016. And you will recall that that is one of the major challenges that has created the stock of energy sector debt. The capacity charges and the take-or-pay charges, which could not be included in the tariffs. And so every now and then a bill is sent to the finance ministry to pay, and that bill is accumulating. If the government is really intended to pay, one of the things it should do is to complete the renegotiation, move the fuel purchases and the excess capacity charges into the PPAs, so that when people consume a certain realistic amount, then they will pay. Number two, government should quicken the efforts to bring efficiency into the operations of GRIDCO and ECG to reduce transmission, distribution, and other technical losses. You have followed the arguments that part of the problem is the losses occasioned during transmission and distribution and collection. If government really means well, that is one of the areas to focus attention and front load. Number three, we're asking government to pursue the strategy that we proposed in 2024 to go heavily into renewable energy, as advertised, for example, in our manifesto, to reduce the need for fuel importation and its consequent negative impacts on the economy. And you will recall that prior to 2024, in the elections, we signaled that if the NPP was in power today, we'll focus heavily on augmenting with solar power, so that this whole thing of buying HFO and fuel for the power plants will be reduced. And you don't have to then come and impose these levies on Ghanaians at 8% to pay for the inefficiencies in the sector, contrary to the promise that you made. In closing, colleagues, it's already clear that the government intends to go ahead with the implementation of this draconian levy, and they will not listen to anybody's plea, anybody's reasoning, or anybody's alternative ideas. We as a minority group representing over 10 million Ghanaians, and sometimes people say, oh, they are just 88. In our 88 constituencies, you will find over 10 million Ghanaians. We want to advertise that we'll be embarking on the following. Number one, we'll continuously engage the people of Ghana, civil society groups, driver unions, and the media to showcase the true impact of this draconian and negative levy that the government is imposing on us. Number two, we'll continue to stand with the groups of honest Ghanaians, the driver unions, the Chamber of Oil marketers, who are opposing the levy or asking government to pull back and to engage better, and not to go by this midnight introduction into parliament and using their numbers to push it through. We know the government has a lot of goodwill, but this is not the way to do things. Number three, we'll continue to stand in solidarity with the Chamber of Oil marketing companies in their position that this downstream sector is already heavily overtaxed. And now if you add this new levy, effectively about 26% of what you are paying at the pump is all taxes. And we'll continue with our advocacy to government to withdraw this levy and adopt less painful and more pragmatic options, some of which we have suggested in this afternoon's press briefing. We are grateful to you for your attendance, and we look forward to further engagements on this subject. We'll take your questions and do a quick summary in chief.
All right, thank you very much. Just please, your name and station.
Thank you very much. My name is Ajona.
Why are you giving the first bite to him?
Yeah, it's for mischief purposes.
Your microphone should be on.
Oh, sorry.
It's okay, we can hear you. It's okay. It's okay.
Thank you very much. My name is Ajona. I'm director of FM News Online.
Can we have some silence here, please?
Two quick questions. Honorable, you...
One question. One.
Okay.
You are
basically, you are asked to come and address us on the economic component of the E-Levy. But through your explanation, you seem to be highlighting details on the levy. Can you please tell us the economic implication of this E-Levy? And as you compare the E-Levy to current levy, at the time that E-Levy was imposed on us, the fuel price then was around 18 cedis. As it speaks today, the fuel price around 12 cedis, and even LPG from 15 per kilo today this morning was ACD 20%. Why did they compare that to this situation that government has no business of taxing the fuel from?
Thank you.
Please.
We shall respond to that. There are two questions in that: the economic implications, and then the argument that fuel prices are low, so it's okay to slap a tax now. I'll respond to both. Let's take a few more. We'll respond.
Yes, please. Your name and then your station.
So my name is Steven.
It's okay. We can hear you.
Sure.
Because they have this one, it's not good enough. So.
Yeah, go ahead.
Yes, you alluded to the fact that Ghanaians did not get opportunity to discuss the use of levy before it was introduced and passed. But then, among the things that you are going to implement, I'm happy that you said you are going to engage various stakeholders, especially those in the transport sector, and then others. But I would like to ask you, would you consider doing so by getting closer to them at the various bus terminals, churches, mosques,
We have started.
and other public places, to let them know the real impact, because that is where they will feel this impact. So when you get closer to them, especially in the morning, and then you engage, then Ghanaians will begin to know that this is what they are going to do, as you have alluded to in this.
Thank you.
All right. So
We'll take a few.
yes, Ibrahim. Ibrahim.
Yeah, thank you very much. Yeah. First of all, I wanted to respond to this because that has been the defense from government that if proceeds of ESLA had been properly utilized by your administration, we wouldn't be here today. And two, in preferring solutions as alternatives to what government has done, we talked about adding these cost items to the power purchase agreement through renegotiation. And that will have reflected in the tariffs that Ghanaians will be paying for electricity. How is that different from what has been?
It's a very good question.
Very, very good.
Very good question. I'll respond to that.
So, how
and
many
then
more do you want to
let's
take?
take a final one. In there.
Okay, I'll give him one, and I'll use my powers to give you the final one.
All right. Okay. Thank you very much. Okay. Thank you very much. I listened to your question. You calling for.
You listen to.
Your presentation. Sorry, statement. You're calling for total withdrawal. Do we have problem at the energy sector, and what percentage of levy will really help? And lastly, my worry, as you indicated, that is sneaked it in. Looking at their numbers and your numbers, I think there is this developing tendency at your end. Why is it that you said mighty minority? But the numbers over there, to tell Ghanaians that you are widely awake, we don't get the numbers over there. How are you addressing that one?
See, I wasn't giving you the opportunity. Please. It's not a fair question. What is that? Yes, yes, please. It wasn't there. Yes, please. Is it Metro? Very well. Please proceed.
You mentioned a few suggestions to deal with this. Now, does it change the fact that even though we could renegotiate, we could move the fuel purchases and excess capacity charges, bring efficiency to the operations of ECK and Brico, we could do all of these things, but it will still not change the fact that we have to pay, maybe at a reduced cost. So if we still have to pay, what would the minority suggest the payment plan and the payment approach and the method be, but the taxes?
So let me respond to this first set of questions.
Is that TV3? Oh, okay.
Let me respond to the first set of questions. about the economic implications. So again, I'll take you back to the past. When a 1% levy was introduced on transactions that people elect to do, we were told that the economic implications were such that it will bring economic hardship, it will contribute to inflation, it will add to the difficulties of people. Today, an 8% levy has been imposed across board on all fuel, or at least petrol and diesel. As a start, you can clearly tell that as the driver unions are beginning to warn, eventually it will catch up with fuel prices. And when it does catch up with fuel prices, when fuel prices go up, the transmission effect is such that the prices of goods and services generally will begin to go up. Now, secondly, you are asking a question about public engagement. Yes, we intend to engage in various forms. Today we are outlining to you some of the things that we are going to be doing. We are not ending here. We'll be engaging at various levels to get people to understand the real incidence of this taxation and how it affects their daily lives and how it translates into the prices of goods and services as they go up. There was a question about, will passing it through the tariffs be any different? And let me answer. You see, tariffs are not set by government suo motu. Tariffs are set by the PURC. So the government will sign its PPAs, and the power producers will go and make a case to an adjudicator who will consider all of it and decide how much of it can be passed through. When government chooses not to put the fuel purchase and all the other matters into the PPA, but to do it on the side, to create a debt and then to come and slap you with a levy, there's nobody to look at that and to say that this can be passed on or this should be absorbed by the power producers. And that's the big difference. That's why we're saying that if you really mean well, let it go through the system and let the PURC and other entities have an opportunity to examine it and make a decision what you should absorb and what should be passed on. If government decides to keep it on the side and then charge you 8% to pay for it, you should be worried. There's a question about what percentage of levy will be a good idea. We've been clear. We are not asking for any percentage as a good idea. We are saying that listen to the driver unions and the oil marketing companies and the general public, pull back, engage some more, and find better ways of doing this other than just saying that because we have the numbers in the chamber and because we have goodwill, we will just slap it on people. Now, there was a question about the operations in the chamber. We have our strategies that we use to litigate all sorts of matters in the chamber. When the majority side decides that they will not in good faith advertise ahead of time that we want to introduce this tax. You were all here. You recall when we were approving the finance minister, and we drew his attention to the fact that the claim that he will increase revenue without increasing taxes cannot be true. I'm sure you were here. You recall. And that if indeed he could do that, we'll support him. Because they knew at the time that what they were saying was not true. On the day that they were going to bring, in fact, the day of the budget, did any of you hear them advertise this particular levy? On the day that the business statement was read, prior to the sitting, did any of you see this on the order paper? So I'm not the one saying it. You are witnesses. Now, when they demonstrate such bad faith that they won't advertise it, they won't let you know, and last minute they will tell you that we have the numbers, we'll push the numbers through, what are you left with? You have to let them have their way and draw the attention of the public to what they are doing. And that's exactly what we are doing at this point in time. Finally, there was a question on what sort of renegotiation. So, first of all, this issue of energy sector debt is not new. Recall that when we assumed power, it was at $2.5 billion, and the World Bank forecast said that it was going to get up to about $12 billion if nothing was done about it. I'm sure you've all read those reports. What our administration did was to start the process of renegotiation. You saw many times when IPPs would threaten that they'll switch off the power if we don't pay. And our teams, I recall Dr. Amin Anta and other teams at Finance and Energy, had extensive negotiations with them to ensure that they didn't carry through their threat. That is what a government does. So that you keep on the light without necessarily passing on bills to the Ghanaian people. That is the kind of negotiation that we're expecting this administration to put up when the IPP is back. Not just to say that we have goodwill, so Ghanaians swallow 8% tariff. There was a question about ESLA and its usage, and that you should blame the MPP for this levy. I'll let Honorable Abuaje handle that.
Thank you.
All right, so you're watching a live news conference from Parliament House. That's the minority side on both the Energy Committee and also on the Economic Committee, and they are reacting to the 1 cedi imposition on every liter of fuel through the ESLA, or the amendment that government passed in Parliament last week. We remember that President Mahama has signed off on it. Implementation was expected to start today, but the GRA says that they are allowing some kind of consultation and recalibration before that will be done. So implementation has been pushed to the 16th of June, that's this coming Monday. But the minority says that it is not a good, passage. It is not a good tax imposition, and they are asking government to withdraw it, allow for some consultation on the way forward. But on their own, they say that they will be coming up with a series of, programs to drum home the need for government not to burden the Ghanaian taxpayer with this amount. Let's bring in some reactions on this matter, and of course, the ranking member on the Energy Committee in Parliament, Emmanuel Bejra, joins me on the phone. Honorable, good afternoon, and a pleasure to have you here on the pulse.
Good afternoon, Elton. I'm not a ranking member. I'm the chairman of the...
Forgive me.
You are reducing my post to Elton.
Forgive me, my apologies. So the chairman of the Mines and Energy Committee in Parliament, Mr. Emmanuel Bejra, is joining us for some reaction. So you've heard your colleagues on the other side. First, perhaps if you can help us get some clarity on what exactly this levy is seeking to cure. Is it to address the debt in the energy sector, or to buy fuel to power the plants that generate power for us?
Thank you very much, Elton, and good afternoon to your cherished viewers and listeners. Elton, let me also correct you that the committee is now Energy Committee, not Mines and Energy. It used to be Mines and Energy. Now it is Energy Committee. Okay. And so our jurisdiction is over the Ministry of Energy and Green Transition, which has oversight over petroleum and power as well. Elton, as you know, answer your question, this levy is basically, if you look at the memorandum that was sent to us from the Ministry of Finance, is basically to buy fuel, to buy liquid fuel. Now, you notice that last 2 weeks, when we were meeting with the Minister for Energy and Green Transition, he mentioned that we have shortfall, and that if nothing is done about getting liquid fuel, the IPPs will shut out their machines. And so we probed further and got to know that liquid fuel was not factored into the computation of tariff by PURC. And so we met with PRC, and they also confirmed that liquid fuel wasn't part of the computation of tariff. And so government all these years have been taking care of the liquid fuel to propel their generators and their engines as thermal plants. And so when current government noticed that the previous government owes a lot, could not even pay for to our IPP, could not pay for the fuels that they are supposed to use, we thought that, well, the best thing to do is to, just add 1 cedi to a liter of fuel. That's petrol, diesel, marine gas, for us to use the short, there is a small window for, a fall for us, in which we decided that why don't we use that to pay for fuel, and that will not increase the fuel prices. If you manage your economy very well, and you are able to make gains through the management of the economy, and your CD is doing very well against major currencies, and there is a shortfall, and world market price of fuel is also going down. That difference, we want to use it to buy fuel so that our plants can work and there will not be any shutdown of our plants. Okay. That's exactly what this government has done. And I don't see any problem with it at all, where I see, because we are not going to increase the X pump. That's, those from where you are buying from the filling station. There's not going to be any increment at all. It's just that government will not reduce the price again. And if there's any reduction beyond that, it will also reduce.
All right.
That's exactly all.
And then kindly hold for me for just a second. Let me bring in Samuel Amwaku, who is the Deputy Public Relations Officer with the GPRTU. They've made it clear that they may be embarking on a strike tomorrow in protest against this levy. Mr. Amwaku, if you are there, good afternoon, welcome to the program. Mr. Amwaku, if you can unmute for me. Yes, good afternoon, Mr. Samuel Amwa. Well, we'll try and get Mr. Samuel Amwa's attention. He's the Deputy PRO of the GPRTU, but still on the line with me is the Chairman of the Mines Committee. So, Honorable Bejua, are you able to tell us how much, for example, the country require in terms of fuel on a yearly basis to power the thermal plants?
Well, as put out by the Minister for Energy, every year from beginning of, we need not less than 1.2 billion US dollars, which is about 12.6 billion Ghana cedis.
Right.
And so that's at the exchange rate of 1 cedi 50 pesos. And so we need close to 12.6 billion. And so the 5.6 billion is just half of what we are anticipating. The 5.7 billion that will be raking from the 1 cedi on every liter is just about half of what we are looking for.
So the rest is coming from where exactly?
Additional funds.
So the additional funds will come from where?
From government. I mean, government has been taking care of the 12.6 billion all this while. And we thought that it's time for us, if we don't want PURC to increase tariff. In fact, when we engage PRC says that increment of tariff will be not less than 50% of a current electricity tariff. Is that what Ghanaians are looking for? Is that what MPP people want us to do? We are not prepared to increase any electricity tariff. In fact, the president has made it clear that he does not want to increase electricity tariff. And so the best thing for us to do is to cushion Ghanaians by using this levy to increase just 1 cedi on every liter. In Ghanaians, I believe a lot more people understand us than the minority that is crying wolf with that, If you ask them carefully, they'll tell you that they are not against it. All they are saying is that there should be consultation, and I believe the consultation is also going on. COMAC, that came out recently, you say that they've not been consulted. Government consulted them, and they released there's a press release from COMAC that, yes, indeed, they have been consulted, and they are with us.
Kwajon Frank was ranking on the Economic Committee, and of course, Mr. Abuaje, the ranking on the Mines, the Energy Committee, both are saying at this news conference that we brought it on some few minutes ago that there was no consultation even at the committee level, and that this, first of all, was not on the order paper. It came in an addendum under a certificate of agency, so there was no room for even members of parliament to peruse whatever government was seeking to do, only to, according to him, to be, for want of a better word, swindling them under the cover of majoritarian rule in parliament.
These are all populist way of doing things, populist way of attracting, national. And I believe that Ghanaians will begin to know who the minority are. If you really carefully want to help Ghanaians, the floor of parliament is there for you to debate. Elsie, you have been a correspondent from parliament over the years. You don't need to walk out. If you walk out, you are giving the opportunity to the ruling government or whoever is there to continue to do their debate and pass the law. Why didn't they stay on the floor of the House to debate for Ghanaians to know that indeed the debate is against or for? They were not there. They just walked out. If indeed we have not consulted them, why didn't they walk out when we were at the committee level? At the committee level, if you look at the report, it was stated that it was a majority report. And if it was a majority report, you should stay in the House to take your the vote? Why did they walk out? What were they afraid of? And they should stop throwing that into people's eye that they were not consulted. They were not consulted at the committee meeting and then committee level, and then you say that it was a majority decision. If you were not there, I mean, we have the hands up, we have the minutes there, that they were all there. My deputy ranking was there. My ranking himself was there. I was there. I joined the finance committee. Honorable Anta, who was a former minister, and as well as the minister for ranking member of finance. We were all there. We all looked at this, and then when we got to the floor, they walked out. They should stop throwing that into people's eyes.
So, Honor, we are saying that this matter was discussed at the finance committee before it was brought on the floor.
The energy committee, leadership of energy committee, were also invited. Okay. My ranking was there. My deputy ranking was there. My vice chair, including myself, were all there. It was on the floor that they walked out. And so they should stop deceiving Ghanaians. I don't know what they will gain from deceiving the public by saying that they were not consulted. Even if you were not consulted at the committee level, why didn't you make your voice made? They made their voice made, and they said they were not going to. It's not going to be a consensus, and so we wrote a report. We said it was majority report. I was there myself. So on the floor, come and advance your argument. Come and debate your argument. You don't go to the public and say that you were not consulted. If you were not consulted, why did you walk out? Why didn't you make your argument known?
The other concern, and I'm sure that you can help address this for us this afternoon, for a lot of Ghanaians or some who are complaining about the effect this will have on transport fares and our daily lives. E-levy for some was optional, but in terms of fuel, it will affect every facet of the economy. GPRTU says that they may go on a strike tomorrow. We are being told that they are discussing the way forward as far as this matter is concerned, because already we had a windfall resulting in drop in petroleum prices. Now, on the 16th, if this is finally out and rolling, the 1 cedi imposition will mean that what was, from January up to now, we've seen only 2 Ghana cedis, 4 pesos reduction in fuel prices. And that obviously is going to get them to either they increase fares that they've reduced or, just, take the heat that comes with it. What will be your reaction to those who think that this will impoverish them in a way because of how sensitive fuel matters are to our economy?
My brother, we kept saying, and I have to educate every Ghanaian, that there will not be any increment to the fuel prices. There will not be any increment. And you can take it from me as the chair of Energy Committee. There is not going to be any increment. All we are seeing is that there's going to be a further reduction. That further reduction was what we have factored into to make it 1 Ghana. And so, at the world market, as well as looking at our economy, the cedi appreciating against dollar, we are saying that difference is what we are using to buy fuel. And so there will not be increment. If the transport owner decides to reduce prices as a result of petroleum rates, the same price that they are buying it today, they will continue to buy it. So I don't see why they'll go on whatever it is, other strike or demonstration, because there's not going to be any increment. It's going to be the same amount.
And then finally, how do we ensure that the revenue that will come out of this levy will be used specifically for the purpose for which it's been imposed on Ghanaians? Because, there's precedent to it. We've been paying toll recovery levy for years. Toll is still in debt. So how do you ensure that this will help deal with a major challenge in the energy sector, and that is, fuel matters relating to debt?
John, if you hear the president clearly stated that there was going to be an audit of this account every now and then. It's not going to be yearly. It's going to be quarterly, as they do what we call the quarterly windows. And so we have factored that in our law. The law says that there will be auditing, and so this auditing will come to the floor of the House for people to know how much has been raked in and how much has been used for this particular, levy. And so there's no fear at all. The money will not be sent anywhere. From where I sit and what I've gathered, it will be used judiciously by the GRA. All
right. Chairman of the Mines Committee, Honorable Emmanuel Bejua, thank you so much for your time with us this afternoon. Okay, so still on this matter, I remember that the Ghana Revenue Authority, they have the responsibility of collecting the revenue that will come out of this levy and any other revenue that government imposes on the nation. Now, they issued a statement this morning postponing the enforcement of this revenue measure to next Monday, 16th June 2025, and they've explained it in that news release. But they've also warning that those who may not want to charge will face sanctions. Listen to the Chief Revenue Officer in charge of policy and programs at the GRA, Smile Agwemenu.
In 2025 this year again, start of this month, government thought it wise to consolidate all these taxes and then assign all of them as the tax for collecting by GRA. So MPA ceased to be collecting what they used to collect as the price stabilization levy. The price stabilization levy, the sanitation and pollution levy, the energy sector recovery levy, and all those taxes have been consolidated into one tax, which is the energy sector shortfall levy.
Okay.
So this is what had been increased by 1 cedi for some products and for some of them by 20 Ghana pesos.
Okay.
So if you look at petrol, if you look at diesel, as we popularly know, they have been increased by 1 cedi. So what we do is to, one, configure the system that we use for the administration of petroleum liftings and payments to add the 1 cedi collection per liter to it, which GRA has done. 2 is to issue a Commissioner General's directive, which we call the Tariff Interpretative Order. That details the intention of government, the implementation of the Act, and how we are expected to collect the Act, and which of the products it affects. That has also been issued, and in that one also comes with the start date of the implementation by GRA, which has been communicated as the 16th of this month. Then we direct the oil marketing companies, we direct the officers themselves who are also at the depots, what exactly is expected of them. So every concerned stakeholder will be notified through this tariff interpretative order, which has been done.
Right, so we await the official rollout on Monday, 16 June, but ahead of that, they are consulting all interest groups on this one. Let me bring in Samuel Amwa, he's Deputy PRO of the GPRTU. Mr. Amwa, good to have you. Good afternoon.
And thank you for having me.
Great. So, clarify this for me. Are you still going on the strike tomorrow?
Yeah, thank you very much. Let me use this opportunity to say good afternoon to yourself and your cherished viewers and listeners. Yes, the strike action has been suspended based on a meeting the leadership had with the ministry just this afternoon. You know, our issue was that we don't want the situation whereby some amount of money is going to be added to, the fuel product as we go to the pump to buy. And, quite recently, there has been a reduction on our transport fare. And, as we used to say, the transport fares was reduced only, on the petroleum product. That was the reduction petroleum product. And, when fuel price get to around 12 cities, that is when we will reduce our transport fares. And when it got to 13 cities, we did that based on the information the ministry gave us that the next pricing window is going to reduce to the 12 cities, around 12 cities per liter, of which we've seen that. So our problem was that we don't want to see, additional cost on the petroleum product again. So when the ministry engaged us, they made us understood that It is not going to affect the pump, and there is not going to be any change, as of now. And then we told them, we asked them how are they going to do it, because should it go high again, then it means it's going to add another operational cost to our operations. And they gave us their word that it's not going to change, and even the coming 16th, that is next week Monday, that they are going to commence, or it's going to take effect. We are not going to see any change at the pump when we go out there to buy fuel. So we understood, it's okay, fine. Then we'll stand by and look at what will happen next. And should we see a change, that is a rising change, then it means that we have to advise ourselves. So as I'm speaking now, the strike action has been suspended, waiting for what will happen next week, Monday, to see whether it will go up or it will still stand the same.
So that means that on Monday, if we don't see a change in terms of pricing, you will call it off completely. The reason you've suspended is that you want to see evidence of this on Monday.
That is correct. That is correct, because we don't want to. We don't want a situation whereby we go to the pump and we are buying fuel, and this time around, once it is going to be added to it again, it means that money is going to come from, the pockets of our drivers, and that is what we are preventing. So if it happens that yes, on next week when we go to the fuel pump to buy the fuel and it's still the same, praise God. If it changes, then we see, that it has risen up again. Then it means we have to advise ourselves and, do what will help us to, continue with our business.
But you also had issues with lack of consultation on this matter. One of the reasons you raised in your news conference that announced your industrial action. What about that? Has that also been addressed for you at this meeting?
Yes, we made them understood that we are major stakeholders, and that, should something of this sort, there has to be a consultation, because they can't just, wake up and slap our face with, all this debt, because we are going to pay the debt. We are family members, and we, the family members, if the family, is in debt, and they are to, share this debt among the family members, and some of the family members will not be invited to explain to them why they should pay that debt, then it means that, they are not being fair to us. So we addressed that, and we made them understood that. And, well, they apologized to that, and they promised, not to keep updating us whenever things, happen this way.
So this afternoon, you are telling your members to work fully tomorrow?
Yes, that is correct. I'm speaking on behalf of GPRTU as the Deputy PRO that we have suspended the strike action, waiting for what will happen next week, Monday. That is the 16th, when this 1 Ghana cedi levy is being implemented.
All right, Mr. Samuel Amwa, thank you so much. He's the Deputy Public Relations Officer with the GPRTU. And the news is that they are no longer embarking on a strike tomorrow, because they've been told that the imposition of 1 cedi levy on a liter of fuel will not affect prices of petroleum products beginning Monday, and they are holding government to that word. And so if by Monday they don't see any change in terms of upwards review of petroleum products, they will call off the strike completely, but for now it is suspended. Let's take a short break here on the pulse, brought to you by Defend Drill Cough Mist. When we return, we'll talk about another strike that is already ongoing. And this strike has been called by the Nurse and Midwife Association over government failure to implement agreed upon conditions of service. We'll return and take you to the walls to see what is happening there when we return. And of course, you're welcome back. This is the pulse, brought to you by Defend Drill. And of course, your comments welcome. I will soon share with you the comments that your comments on the matters we've discussed so far. But let's talk about a very important matter now, and it's about the health of you. Now, the Ministry of Health is this very afternoon engaging striking nurses and midwives to find a lasting solution to the impasse. There's been chaotic scenes in public health facilities across the country as the nurses' strike enters a critical phase with a total withdrawal of services. Now, patients are stranded, clinics overcrowded, and doctors overwhelmed. Now, despite the court injunction, the nurses and midwives insist they won't return until their collective bargaining agreement is implemented, and this they committed to in July 2024. Something government says must first be reviewed. We are keeping our tabs on that meeting between the Ministry of Health and the striking nurses and midwives for updates. But first, let's go on the ground here in Accra. And my colleague Collins Frimpong visited some facilities in Accra and reports that industrial action continues to bite hard, with the elderly and babies, being the hardest hits. And he spoke to some of them.
We've been to 3 health facilities in the Greater Accra region, including the Adabraka Polyclinic and also the Greater Accra Regional Hospital known as RIDGE. Here is the Kolebu Teaching Hospital, where we are trying to assess the impacts of the strike by the Ghana Registered Nurses and the Midwives Association. And one thing is synonymous with these 3 health facilities. That is, patients are stranded within these facilities. Nurses, there are no nurses around to attend to them. At the Adabraka Polyclinic, we engaged the medical superintendent at the facility, that's Dr. Abdul Razak Kwao, and he gave us details of what is really happening within the facility. He told us that the facility is currently short with nurses because on average they need about 40 nurses to operate on a particular shift. But currently they are relying on just about 5 nurses who are not part of the strike that is ongoing. And also they have made calls that they are looking at 3 nursing assistants to also come in to support them. At the Greater Accra Regional Hospital, also compared to last week where patients were not getting any access to healthcare, this morning the situation was quite different. Management of the facility have been able to put measures in place where doctors are now playing dual roles now. While they are looking at playing their own or doing their own work, they are also looking at playing the functions or doing the functions of the nurses and the midwives. We engaged some of the patients there, and they also told us the issues that they are facing, and they pleaded with government to ensure that all that the nurses required are also provided.
Me brother na ba e bedu a 5:30. Me si sa time yen hwe. No mo se nurses for cause strike. Inti doctors for the ba hwe so mo ward nso still mo ma nipa bebre ba kra ba yo mo ko. Inti esra ban se ne nurses for hia no nya mo na ye ba o matimi ahwe ese nipa nkwa ho hia.
Na de wo ha na mo de ba
me nua ne ye call cardio na ye me ekotwa na koma nti one ne de ba ye.
Ene na ese nka mo ba na nka
ese se be hu doctor no. And they buy and so up to now, that's what you.
And that's the baby. Right. So that's the situation here, a sad moment. So she came here with her brother who had issues, a surgery around the heart, that today they are supposed to see the doctor to review the situation, but they are not getting anybody to assist them.
I pay member last month, and I almost share me say member on the 9th. I didn't see me buy.
Na idea potting now the buy.
Makumaso, I see Yarebe Makumaso. Until me buy. Until me be who Akuma doctor. Until me buy and I must say one young buy and tea and train. Until you go sweet train.
About how many minutes? I'm not doing saying already.
I know, and dream maybe as a see an room. The see an room. Tia who next for no say. Yantrasna doctor no nyamba obaba anything I buy
say bia wonya nurses and as doctors am o man show wo baby a wo ko
ni baby a me ko jise me ko fie but the last month and me yare me yofu mum na me ya nti ma be bibia wie say o me surgery and doctor say yare bi da makoma so ise o mu kio yare na sa no my surgery no. And no, I can me back up and down since last month. Me back up and down. Sunday we and I'm friend say member on the knife. And I have a dry. Yet it's one. I'm say Dr. Nyambayan.
And I me back review. I'm by so nurse for cause strike. Until now, just me my home make a grammar sorry coffee.
Or how bad potty now what buy review no there and cow baby.
Me operation me con. Operation tika sabe me review ma member review last week almost was strike, this week is almost strike. Say me nim da omo beba eno na me pese me hwe nya me de but say me ba review na doctor who say me okay bamba ya just me san kofi
For doctors, hospital managers, and say, or mama doctors for no astepi in a juma is and nurses for na or more and doctors for near babe. Monyan in Tibisa will be a cabisa.
Be a brand you card or some coffee.
You card in Suku.
So money. Now doctors in ho. Nurses in ho until moon to be a juma. So nurses in the boss agents. No nurses in ho. So I give me coffee.
At the Kolebu Teaching Hospital, the situation wasn't different from this what we witnessed from the other facilities. But here, there was a scene at the emergency ward based on the information that we've picked on the ground, where nurses, the senior nurses somehow clashed with the junior nurses because the senior nurses were trying to provide treatment, healthcare, to patients that were already on admission, but the junior nurses won't allow that to happen. But the authorities also came in to ensure that the issue was resolved, and the information that we had is that at this particular moment, the facility is not admitting any patients again, but those that are already on admission, those that they've already been here for some time now, they are trying to provide treatment to them, healthcare for them, so that they can be discharged in the meantime. Also, when we got here, we also saw about 10 police officials over here. That the information, based on our interaction with them, what they told us was that they are here to assess the impact of the strike.
All right, so let's check what is happening outside the shores of Accra. Let's head to the Upper West region where Rafik Salam has been doing some checks and the impact so far. So Rafik, welcome. So is the situation different from last week? Right, if Rafik can unmute for me so we can hear you. It looks like we are having connection issues with Rafik Salam. We'll see if we can rectify. So, Rafik, if you can hear me, last week and today, Monday, is the situation any different? Well, but Rafik has been speaking to the deputy chair of the Health Committee in Parliament. If that video is ready, we can bring that on while we bring in Rafik. So listen to Rafik's interaction with the Vice Chair of the Health Committee of Parliament, Mr. Sandari.
Oh, it's biting. Even if one nurse or one midwife doesn't go to work, it affects health service delivery because there will be a vacuum created. And you can see the number of health facilities we have in the Upper West region, from the regional hospital to district hospitals, to health centers, to CHIPS compounds. So it's really a very serious situations. Some patients have told me about their stories of going to the health facilities, and how they expected service to run fast is not what they expected. There might be some nurses holding the fort, but the skill mix will not be the same. I mean, they may be using other staff that would not have the same qualities or the same skills as those who are striking. So it's really a serious issue. Like I said, we just have to find a solution to it.
Right, so that's the Vice Chair of the Health Committee in Parliament, Dr. Sebastian Sandari. Rafik Salam. So Rafik, is the situation any different from what you reported last week? Well, we don't have Rafik, so let me move to the central region where Abigail itself in Kroma is on the ground for us. So Abigail, is it the same like we are reporting Accra in other parts of the country in the central region? So Abigail, if you can unmute for me and tell me what the situation is in the central region. Well, we were not getting her attention. Abigail, if you can hear me, what is the situation in the central region?
All right, so today we went to the Cape Coast Teaching Hall. So to observed the happenings during the strike. Upon entering the hospital, you may assume the strike is not in session or is not effective, but it is. We saw some members of the Union of Professional Nurses and Midwives Ghana, assistant doctors, as well as rotational nurses moving around assisting patients and doctors in the hospital. We spoke to some patients who have come to seek services for maternal issues. So we had two patients who had just undergone cesarean section last week, and they tell me that since they came to the hospital that morning or this morning, no one has attended to them. Usually when they come, you find nurses there attending to them, checking their vitals before they go to see the doctor. But for today, they've been sitting there for hours and no nurse has attended to them. And when they ask, they say the nurses are on strike and they don't have adequate staff to attend to them. So they are just stranded and they are pleading, joining the call to government to heed to the demands of the nurses so they can come back to work, help the patients and deliver quality health care.
Right. So we can listen to some of them, those you interacted with when you went there this morning.
About 1 week, remember review. Why I'm serious? I don't Doctor Shemuku, nurses will be on your house. Over check him about us, my doctors. Everybody busy will be hours to work for strike. My woman country so in train. Be a mahadi. It's a had my brand. I also could. Baby, I ever review. Be ampunesses behind you. I sab and them oil bay no yana. So you buy washing.
Back for review. The operation last week. But and then buy you be a nurses be near around. If you say almost on strike. The one woman been me approaching or catch me say main train a doctor Bana. I can't. They say it's why you train. Say doctor be around now. Edi ya 7 opportunity. So first na your bank anka nurses for no midwife for more around. No more check your vitals for her. But na your buy a higher door. Obi a transia no bla no so kufi. Ese me fi wasa te biase. Ore fe kra ni fa ba ko in and out 70 cedi. Minimum nso na buy 140. Ese 140 e be me ka betna ha na masancha ko ba. The Sra ban. The nurses ni midwife for mo dey atu aban ani ma onya nweye no. Aban omo modiana on track ni be show wo. Ayen so ya ba ha omo matumi ahweye. Fa we affect him all the way from to be as any point it.
Right, so that is the situation in the central region, not different from what we are experiencing here in the Greater Accra, in the Upper West region, but is it any different from what is pertaining in the Ashanti Regional Capital, Kumasi? Clinton Yabua has been visiting the Confederate Teaching Hospital, the South Hospital, and the Pampaso Children's Hospital. Clinton, what can you report?
Well, here in the Ashanti region, the situation seems to be the same. However, a certain twist when you get to Confanoche is that unlike last week where patients were trooping in, but then they met nurses who would then tell them that they are on strike, this time around they are coming to meet empty wards and empty units. So even at the Confanoche Teaching Hospital, when you get to the emergency unit where it's a very busy area, very crowded area that daily you would find people there. The place was empty with beds empty. And what I find also very intriguing was that the beds were being moved out. When I inquired about why the beds were being moved out, they told me that they are trying to put on a small cleanup since the place is not in use. But then when you step out and you engage some of the patients who have come to seek healthcare, what they tell me is that some of them were booked for appointments with their doctors today. When they came, the only thing the doctors could do was prescribe them medicine that could take them weeks. That is to say that they are somehow compromising on this medication, just so they do not know when the strike will be called off. So they are compromising effective medication that could take patients weeks and months. Apart from that, also for people who have already been admitted at the hospital are now being prematurely discharged, and so you meet someone who is not so fit, but then has been discharged to go home and given a prescription to go for. They complain so much that why were they not informed, especially those who were given appointments, why were they not informed before they were let into the hospital just to be informed later? And now they are stranded at the hospital, they are paid their medical bills, and they show the bills to me asking why they would go through all the processes. The essential one, that is to get the correct care from nurses, they do not get.
And does it in any way suggest you the fact that, last week, the striking group said they will be withdrawing total services this week, which means that those even on admission will be asked to go home. Do you get a sense that it's already taking effect?
Yes, it's taking effect because the leadership that I engaged last week on this particular issue, this week, were not in the hospital. When I called and I asked them that I wanted to have a conversation with them, they told me they are not coming to the hospital. And the nurses that I met at the hospital are not in nurse uniforms. They have actually taken down their uniforms and wearing cardigans. And so what they tell me is that they will not put on the uniform just so people even approach them to seek for their help.
Right.
So they will just put on home attire.
And then finally, Clinton, I mean, there are some nurses who are not really in favor of the decision taken by the Nurse and Midwives Association. For them, they want to continue to extend health service to those who may be in need. Did you come across any group of people working in the midst of this strike?
Unfortunately, no. I don't know, fortunately or unfortunately, no, at the Confanochi Teaching Hospital. They seem to be in unison with respect to the decision that has been taken by their leadership.
All right. Clinton Yaba, thank you so much from the Ashanti Regional Capital, Kumasi. And soon, I'll take you back to the region, but this time to Mambon, where final funeral rites are underway for the late Manhenin of the Mampon traditional area, that's Osebon. So if you like, the vice who until he's the vice president of the Ashanti Kingdom. But Ivy Setoji is in the voter region. Now, Ivy, is the situation any better?
Not really. The situation is not any better. At the whole teaching hospital earlier today, a few of the nurses were in their uniforms, but we were told that there were rotational nurses. I don't know what that meant, but that was when we were told that there were rotational nurses, and some of the nurses were also, some people have been called, professional workers have been called to help at the hospital. Right. So that the persons will not be neglected. And so most of the hospitals we went to, we couldn't find the nurses. Most of them are not working. Even those who were there were not in uniforms, according to some people we spoke with. At the municipal hospital in Ho, we were not allowed to go in because, according to them, they will have to get clearance before journalists were allowed in. So for now, the situation is not different from the voter within other districts. So we have similar situation where a few nurses were there as rotational workers, whilst the others are not working. Right. Patients are suffering. Patients are asking for the authorities to do something about the strike, to pay them according to them so they can be able to attend to them, because some of them have emergencies to be attended to. Some have operations, or they need to be operated on, and they don't have nurses to help. And so they are asking government to do something about the situation so that the nurses can get back to work.
Ivy, thank you so much. And of course, the rotational nurses are the ones who have just come out of school and they are being given practical experience. So they are moved from hospital to hospital. That's why they are called rotational nurses. Rafik Salam, if you can hear me for the third time, tell me what is happening in your region.
this one it will be better.
Oh, of course, it's better.
Okay, Alton, the situation in the Upper West region is not really different from what we are hearing from the rest of the country. Currently, I am at the War Municipal Hospital, and I can report to you that there is a total shutdown.
Total shutdown.
Of healthcare, total shutdown at the OPD outpatient department and also at the emergency ward. And I can report to you that as for the emergency ward, it's under lock and key. The nurses have decided the place is almost look like a ghost town, and then the patients, inpatients, are not in there. And also, currently at the OPD, I can tell you that there's only one patient who came around, and there's only one nurse who is a member of the UP. And
we are losing you, Rafik. If you can, perhaps, yes.
It's the one thing that there's almost nobody's there. The seats are really empty here, and there's nothing at OPD. When you go to the maternity ward, there are skeletons of staff right at that particular place. And so at the War Municipal Hospital, I can report to you that emergency services and OPD services are completely closed down.
So now that the emergency ward is closed, those who were there receiving medical care, where are they now? Have they been asked to go home?
I'm told that they were told that the strike is no more. The strike is on, and so because of that, they will not be able to attend to them, and so they left the emergency ward, and so probably they will be at other private health facilities in town, and also the situation here, the hospital more or less look like a ghost town, and somewhere along the line, I saw goats and sheep. They have really taken over. Probably, I thought that they also came for medical care, but they were also jumping around the walls and a whole lot of things. So currently, I'm just close to the emergency ward, and you can see clearly that it's locked. You can see that it can't open. This is where I am in now. And then these are the other wards. Few patients right here. There are the pharmacy services, and then very few people also around that particular facility. And so the situation in this particular hospital, the War Municipal Hospital, is currently partly shut down, emergency services and OPD services. But when you go to the regional hospital, somehow it's better. Though the numbers there are really overwhelming, doctors there, some of the doctors who are really on leave have been asked to cut short their leave and then come to work. That is the situation at the regional hospital, where doctors there are now doing dual roles. They are now doing the work of the nurses and also doing their own. And so the situation there is somehow better, but doctors have been asked to cut short their leave and then come to work.
So, Rafik, finally, so this facility where you are reporting from, so where are the doctors? Where are the administrators? Have they also left their posts? What is happening in terms of keeping those who are not on strike to work?
The management of the hospital, I'm told that they are at their offices, but I can spot a couple of doctors also at the consulting room, but the nurses are nowhere to be found.
All right. Let's leave it here for now. Rafik Salam, thank you so much for that report from the Upper West Regional Capital, WA. Dr. Mark Nawame is the chairman of the Health Committee. Doctor, I mean, you heard what Rafik told us just some few seconds ago, painting a picture of an abandonment, if you like, from this facility where he's reporting from. The emergency center has been closed, the OPD closed under lock and key, and hospital staff have virtually left the facility. Is the health committee taking an interest in this matter with the hope of resolving it?
Let me say good evening. Hello?
Yes, doctor, I can hear you.
Let me say good evening to the viewers of news, television, and say that, yes, we should expect it. You know, nurses are the backbone of the healthcare system. In fact, health sovereignty, quality, and resilience depend on them. And when they are not there, practically there's a standstill in all departments in the hospital. As a health committee, we have not actually been approached formally to assist them in this negotiations, but actually we want to be part of the solution, and that is why we are saying that the nurses did not complete all avenues for negotiations. Hello, can you hear me?
Yes, I can hear you. Dr. Wanawani, we can hear you. Please go on.
You can hear me?
Yes, please.
For negotiations. Okay. We hope that this problem will be resolved as fast as possible, or else without invitation, the second arm of government, Parliament, represented by the Health Committee, would have to invite all the parties to Parliament for a thorough discussion about the issue. Indeed, the Health Committee is meeting tomorrow to discuss what steps we'll take. But I'm hoping that even before we do that, we are calling on the nurses, on humanitarian grounds, to call off their strike, get back to the negotiating table, and talk to the executive arm of government. I'm saying this because I understand that a tripartite committee was formed to look into the issues and find a solution to it or to implement it. The tripartite committee involved the Ministry of Health, the Ministry of Finance, and then the leadership of the Nurses Association. They've had some meetings already, but I think the last one, which was called around 22nd of May, they did not go because possibly they have lost trust. But we want to assure them that
yes, Dr. Nawani?
Should have confidence. We speak now. I understand there is a meeting going on.
Yes, there is.
Between the minister and then the nurses, and possibly the leadership of the nurses. And I'm hoping that they will come out with a solution. I've looked through the conditions of service that they put forward, and majority of them are very good suggestions. Majority of them are things that even some time ago used to exist. I don't know why, whether it disappeared or not, somewhere along the line. For example, fuel for some category of nurses.
Yes, 100.
I've been practicing for 32 years. Yes, and so this thing used to be there. I used to take fuel allowance when I was in government service, and it used to be there for the matrons and other senior staffs. And so, it's nothing new. Uniform allowance, the government is paying 400 Ghana cedis. And if they now want 1,000 Ghana cedis, inflation has taken place. And once inflation over the years, have taken place, I believe that probably this figure needs to be reviewed. So it is about the figures. Look at this one too. Royal incentive.
Yeah, the rural posting incentives.
Yes, for the rural workers or those who are posted to the rural areas. It's good. I'm from the rural area. We are always lacking staff. If there could be incentives given to the nurses that accept postings to those areas, then probably we might have more staff. But if you look at...
There's also the 13-month salary.
Very good. The 13-month salary. During our budget hearing in Parliament this year, the teaching hospitals and the regional hospitals came over because the facilities were taxed to be paying this 13th-month salary.
Right.
Remember that the 13th-month salary was an allowance that was given to them during the COVID pandemic. And when COVID ended, And in the transitional period, they asked the facilities to pay. Indeed, some of the facilities tried to pay, but when they came for budget hearing, they all complained that, in fact, they couldn't do that.
Right.
And I've seen that that is not part of their condition of services. And I'm saying that is why we need to sit down and talk, because from May last year, when they negotiated, I believe that the situation has changed. And so if the Ministry of Health is calling for them to sit down and jaw or negotiate on some issues, probably some of these things needs to be negotiated properly, because we have to understand, in Ghana, when one sector starts and you don't take steps to contain it, there's always a ripple effect.
Right.
And for example, the 30th month which we are paying to health workers, what about when the electricity company workers also demand for it? What about the water company? They are all providing essential services. What about the police who protect us in the night and day? What about the military that fights to keep the nation going? If all of them come to demand what we call the 13th month salary, what will be the effect on the reset agenda of President Mahama? So we need to negotiate. There's the need for us to sit down and talk.
All right, we'll leave it here for another one. The meeting is still ongoing, so hopefully the two parties. Last week, the Minister of Health demanded the involvement of a third party who will be neutral and then decide what must be done. But as we've been told, this meeting is under the auspices of the Ministry of Health with the striking nurses and midwives, and it's ongoing. That's why we are unable to bring them on this show today. But hopefully, when this meeting is over, we'll have it. Now, the nurses and midwives, among others, are demanding a 13th month salary. That's some kind of allowance, and this will be paid by the facility that they are working with. There's also 180 liters of fuel per month. They are demanding for category of some senior at a certain level. They are demanding 1,000 Ghana cedis for clothing allowance, 1,000 Ghana cedis annually. They also demand allowance for accepting postings to rural areas. These, among others, are the demands. And this was signed off in July for implementation, July 2024, and almost a year on, it remains unimplemented. The reason why they say that until their demands are met, they will not return to the hospitals to work. But the Director General of the Ghana Health Service, Professor Samuel Kaba, has appealed to the nurses to consider the plight of the patients and return to the negotiation table.
Let me also take the opportunity to call on our sisters and brother nurses to come back to work. Just like yesterday, I said to one nurse that if you come to the hospital now, you as a nurse, and you are pregnant, you are going to deliver, because she was a pregnant nurse. What are you going to say? Will you say, I won't deliver today because we are on strike? You'll be shouting, let's all do this. Let's go back to the negotiation table. If it's your auntie, your mother who is sick, what are you going to do? Will you say, I won't take her to the hospital because we are on strike? And when you go to the hospital, who do you expect to take care of your mom or you yourself? So I humbly add my voice to the Honorable Minister that please come back to work and let's continue negotiating.
Well, so we are keeping an eye on this ongoing meeting between the Ministry of Health and the striking nurses and midwives. When that meeting is over, we'll bring you the latest on this matter. But let me take you to the court now, because MPP sympathizer Theophilus Thompson, who allegedly assaulted Joy News journalist Lateef Idris, has been denied bail by the Circuit Court and will reappear in court on 18 June after pleading not guilty to assault and threat of life. 55-year-old Theophilus was captured on video along with the other suspects who are currently on the run, assaulting Lateef Idris during the live coverage of the detention of the MPP Ashanti Regional Chair, Bernard Nchibuesiako, also known as Yaman Wontibim, in Yoko custody. He pleaded not guilty to accounts of assault and threat of life. My colleague, Kenneth Jesse, sat through the court proceedings today and came to with this report.
Well, after several minutes of court deliberation, the accused person, 55-year-old Theophilus Thompson, has been refused bail, although that is not what his lawyer would have wished for him. His lawyer argued in court that his client was not a flight risk and had a permanent place of abode and should therefore have been granted bail. But the state prosecutor also argued that if he was granted bail, he could tamper with the current ongoing investigation. They also did indicate that since some of the suspects are at large, it will not be best to grant him bail. Well, counsel for the accused also pleaded with the court to temper justice with mercy and urged the court not to punish his client by refusing him bail. So hearing the pleas of both sides, the presiding judge decided not to grant him bail and remanded him into custody to reappear before the court on the 18th of June 2025. Well, there are still others who are at large, and the police say they are continuing their manhunt for them. Bigwigs of the New Patriotic Party, including Nana B, who is the national organizer, and also Salam Mustafa, who is the deputy general secretary of the party, all showed up in court to support Theophilus Thompson. The 18th of June is ticking, and we will definitely be here to bring you more. From the Circuit Court, my name is Kenneth Jesse for Joy News.
And it's been 2 long years since the raging waters from the Kosombo and Pond dams swallowed homes and scattered lives across the North Tom in the Volta Ridge. Now today, they endure scorching tents, unfinished houses, and promises that seem to wash away just like the floods. In Joy News' series, After the Floods, Fred Kwame Asare returned to the heart of the devastation where hope still fights to stay afloat.
1 year after the floodwaters swallowed homes, many in Mepe are still waiting for a place to call home again. For Theodora and her family, the wait had been long and unbearable. Her family is one of over 100 households living in temporary UNICEF tents at 3 resettlement camps in the North Town district. Their mud house was swept away, leaving them with only what they could salvage.
That kind of problem.
At Camp 1, a 10-unit structure built by the government sits empty. The flood victims say it was hurriedly constructed and unlivable.
Which 2 weeks? Hey, come to about 2 Holagama. Which 2 weeks? Just 3. You'll be ever packing me. I be household. One may we are torn, Yano Hoggy the camera. Yeah, I mean like Balena, all I be. Look at Allo Bumio. Want to know that Mamma or go at Profio Plinos Ronano Homer. Well, I tell you. I'm a flamina. Nuka komi jela with you. A caleva famina and a capomo. If you got packing me, I'll be sardine and the atro or the camera. You cook Alehama home.
The government's resettlement project remains incomplete, but concerns are growing over the cost and quality of the new housing units.
They are putting up 20 rooms, which is 2 bedrooms, a kitchen, no toilet, no bath, small 6x6 porch. Do you want them to stay or to sleep? And they are laying it without mortar joint. When you push it with your hand, the whole thing will collapse. And this building alone, when I tell you the cost of it, is reaching 1 million Ghana cedis. It's about 800,000 Ghana cedis for these 2 bedrooms alone. Why is the government wasting money in somebody's pocket? Please compensate the victims so that they go to their homes and leave the camps for you.
For these victims, it is not just about shelter, it is about dignity, security, and a chance to rebuild their lives. They are not asking for much, just a home that is safe, decent, and truly theirs.
No chogana mi ya to mi api gi na chi e cho mi le mi nya be chi to pa o ni la plani ba la poji atu api ni a plani ba la poji atu api ko o va pa ki mi dade ko hela nu du la mi enti ni e de ka pomo.
Over 1 year after the floods, they are still waiting, but for how much longer? From Mefe in the Northdown district of the Volta region, my name is Fred Kwame Asari for Joy News.
And of course, we are keeping an eye on this story as well. The full documentary comes away in subsequent bulletin. The program is brought to you by Defend Drill Cough Expectorant. It clears chest congestion, smoothing cough, and fight the common cold, helping you breathe easy and feel better. Defend Drill, as always, available in all pharmaceutical shops and OTCs across Ghana, but however, not recommended for children under 6 years. For bulk purchase, please visit Rapid Improvement Pharmaceuticals. They are on the Spinters Road next to Royal House Chapel, or contact them on 053-666-1432. That's 053-666-1432. Defend Drill, breathe easy, feel better. Folks, that's our show for today. For more stories, log on to our website, myjoyonline.com. Whatever you are up to in the hours ahead, I hope is profitable. My name is Elton Brobe. Have a good evening and take care.